What are the tests and treatment of stroke? The following are the tests to be performed to rule out the stroke and help in treating the stroke. Computerized tomography, CT scan of brain tissue damaged by stroke, cerebral angiogram, a physical exam, blood tests, magnetic resonance imaging (MRI), carotid ultrasound, and echocardiogram. How stroke can be treated? Emergency treatment for stroke depends on whether you are having an ischemic stroke or a stroke that involves bleeding into the brain, which is hemorrhagic stroke. Things will move quickly once you get to the hospital, as your emergency team tries to determine what type of stroke you are having. Doctors also need to rule out other possible causes of your symptoms, such as a brain tumor or a drug reaction. For ischemic stroke, to treat an ischemic stroke, doctor must quickly restore blood flow to the brain. This may be done with emergency IV medication. The therapy with drugs that can break up a clot has to be given within 4 to 5 hours from when symptoms first started. Quick treatment not only improves your chances of survival but also may reduce complications. Emergency endovascular procedures. Doctors insert a long, thin tube catheter through an artery in the groin and thread it to the brain to deliver TPA directly where the stroke is happening. Removing the clot with a stent retriever. Doctor can use a device attached to a catheter to directly remove the clot from the blocked blood vessel in the brain. This procedure is often performed in combination with injected TPA, carotid end arterectomy, angioplasty and stents. For hemorrhagic stroke, emergency treatment of hemorrhagic stroke focuses on controlling the bleeding and reducing pressure in the brain caused by the excess fluid. Treatment options include surgery. Surgery may also be used to repair blood vessel problems associated with hemorrhagic stroke. Surgical clipping, coiling, which is also known as endovascular embolization, surgical AVM removal. However, it is not always possible to remove an AVM if it is located deep within the brain. It's large or its removal would cause too much of an impact on brain function. Stereotactic radiosurgery is an advanced minimally invasive treatment used to repair blood vessels malformations. Please watch next video how to prevent stroke.